Dr. Rajesh Parikh, simply because these many doses have been given and we've been using this vaccine for a year, there doesn't seem to be disaster striking us. Obviously, can't be reasons for WHO to say, okay, let's then just go ahead. They have to follow their process.
Well, good evening, Tanvi. Always a pleasure to be on your incisive program. You and I have an interesting track history, but I'll allude to that a little later. In both my books on the coronavirus and the vaccine, I have been critical of the WHO on several counts, but for now, I have to give them their due. So let us understand the timeline and the process. On the 19th of April, Bharat Biotech applied to the WHO with an EOI, which is called an expression of interest, for a EUL, so a lot of these alphabets thrown around, which is emergency use listing. So they applied for it. And thereafter, they were asked to submit documents, which they have from time to time. And the last of it was actually yesterday. So on the 26th of October, they had to submit some more documents. And I believe on the 3rd of November, we should get a decision from the WHO. But I think what is important and what we have to understand to be able to appreciate the WHO's position a little better is that it is very different from that given by regulatory bodies in nations. In that most regulatory bodies require data, whether it is published or peer-reviewed is often irrelevant, but they need to look at the real data. And that's about it. But with the WHO, there's a lot more than the data. They look at the manufacturing process. They need to look at the real world data, which has happened outside. And since the manufacturing process is proprietary, it is not put out there. So when the WHO looks at this data, because a lot of it is proprietary, patent, intellectually protected information, it is opaque and it is not put out. The pharmaceuticals would not want it that way. Now, when all the data is collated, not just again to repeat the clinical trial data, but the manufacturing, various other issues are collated, it is in the nature of things that the WHO is going to ask questions. That's their job. And when they ask questions, as the answers come in, it's possible, as has happened in this case, that there are going to be some more questions. So this is a process which happens everywhere. The limited process, which is just looking at the data, if you look at that, the European Union has not, EU has not recognized Covaxin, the UK has not recognized Covaxin, nor is the US. But interestingly, on the same day, 26th, that's yesterday, two interesting developments in the US. The US has given Covaxin a grudging approval under other vaccines where people have participated in clinical trials. What this means is whoever has participated in a clinical trial by virtue of having a heroic act, along with a bunch of other vaccines which the US doesn't yet recognize, would be considered eligible to enter the United States. Also, on the 26th of October, yesterday, a company with which Bharat Biotech collaborates has applied now to the FDA to conduct a trial in the US. So there have all been very interesting developments yesterday, but I think the WHO is justified in demanding a lot of data. We cannot expect them to be transparent.
Highlighted, Dr. Parikh, is that, they don't just look at the trial scientific data, but also a lot more about the manufacturing facilities itself and so on and so forth. Now, let me ask you this. Is there a possibility, because, many keep raising this argument, is there a possibility that other controversies regarding Covaxin have also put the, WHO committees on a bit of a alert and edge, or they are being extra careful, whether it's what happened in Brazil or some of the reports that came out about the way the trials were being conducted here or elsewhere? Are those controversies something that will also play in the minds of the panel?
Of course, they should. And let me again explain here that the limited approval, the limited look at the data is what countries do. So even if you look at partially at the data, ours has been the only country which has been in a tremendous rush to approve Bharat Covaxin, and that was also controversial when it happened. A lot of red lights were gone through. The data had not been looked at properly. Turned out it was not a bad decision. It's like going through 3 red lights and not getting into an accident. Well and good. The process by which Bharat Covaxin got its approval was flawed. No other country in the world only looks at the data, which of course is not proprietary, that is open, which looks at the data, has not granted approval. No country has granted approval as yet. Now, as far as the WHO is concerned, there are two distinct things, Mr. Rao. One is data and the other is proprietary information. The proprietary information has to be looked at by WHO. Are you manufacturing correctly? Are your SOPs right? Are all your plants working to the same standard? And that cannot be transparent. They can't put it out there. So what the WHO does is it gathers this information, it doesn't put it out. Finally, it will say yes or no. It will not illustrate all this. As far as the process is concerned, it's clean and transparent. You submit your data, we ask you questions, you answer them, we seek clarifications. Once we are satisfied, we give you a yes or no, which we are expecting on the 3rd of November. And finally, I alluded to my track record with Tanvi on 3 occasions. We've hit a hat trick where Tanvi has raised a very controversial issue, and within days, it has been approved. The last was when I was in Paris, and there was a big mess up with the UK and Covishield, and that within 2 days, they granted that permission. And the UK is in a mess, as I had predicted a month ago. I predicted, Tanvi, if you recollect, that the concern is in the opposite direction. We should be worried about the UK rather than be worried about us. And that has happened. So we've had a clean track record, and I'm optimistic that by the 3rd of November, if information is in and the answers are given, the approval will come in. But even people who have looked at half the data have not given approval. So let's not fault the WHO. I mean, they've made a lot of mistakes, but let's give them some slack when they're following due process.
One other aspect, and Dr. Parikh, if you want to come in on this, while we wait for this, there are also, like you pointed out, the European Union itself and UK and several other countries who haven't given their nod to Covaxin. Now, what can be done to resolve that? What is it that the company itself or the government can actually do to get that name on the list?
Okay, my frank take on that, do nothing. Because it's due process, we should not be seen to be actively and politically interfering in that. Now, I want to add 2 things to the excellent points that Mr. Nilakanthan made. And in fact, both the EU and I believe the UK as well have said that they're waiting for the WHO report. So in fact, what he suggested is what they're about to do. They're waiting for the EU, for the WHO report before taking a call on this. And why this is important to look at what the process is across? I'll tell you what history has shown us. So in the 60s, when the polio vaccine came out, there was a laboratory called the Cutter Laboratory. And this is a very infamous incident in the history of vaccines. I've covered it in the vaccine book. And when they were making the polio vaccine, because the standards were not uniform, exactly what Mr. Nilakanthan said, that they went beyond the standards of acceptability. Some of the vaccines turned out to be contaminated. These resulted in 200,000 children contracting polio because of the vaccine, and resulted, I forget the exact number, but several children who were handicapped for life, and there were even a few deaths. This is the kind of thing that fuels the nonsense that happens in the anti-vaxxers. We are giving them fuel for what they're saying, and then somebody is justified in saying that, well, when so many people got polio because of the vaccine, when so many people died, we don't trust vaccines at all. So whatever the WHO is doing, Tanvi, it's a process that has to be followed. And I'm so happy that none of our panelists, actually that was my concern. I was worried that some of our panelists may bring the race card again and say, oh, because this is India. And I think none of us has brought that up. I think we all understand, and by and large, we've all been in concurrence, that this is a process which has to be followed. And it's for good of all people. Okay, we are in a hurry to travel. But if we are traveling with a vaccine which does not meet certain standards, we then become a danger to other countries.